You can compress the wound with both hands, and then you can take a good look to see how deep the wound is, to see if there's any dirt or anything in it. And also, one other thing you might assess at this time is whether there's any nerve damage or tendon damage, because this wound may be on the hand or foot or somewhere else. If you can move the appendage up and down like that, then you probably haven't cut a tendon. One of the things you have to have on one of these strips, or in case of a disaster, is a safety pin. And you can just scratch the person and ask them, can they feel anything? Is it sharp? And that sort of thing. Now, those two things, if you think you have a tendon or a nerve, then you need to, it's another reason why you need to get to the doctor as soon as possible. But at this point, you can't do anything different than just clean the wound like regularly and tape it like we're going to show. If you think a bone is involved, first off, you should put compression gently so you're not moving the bone, and you're going to irrigate it out much better or much more vigorously than you would otherwise, because the worst thing that can happen is the bone will get infected. And then that is also, if you think the bone is involved, a reason where you need to get to the doctor just as soon as possible. And if you can't get there, start on some antibiotics right away. Okay, so how do you irrigate the wound out? Well, if you have tap water, just use plain old tap water. It doesn't have to be sterile water, it needs to be drinkable water. So if you have tap water and it's available, just put the tap on there and just irrigate it out. You want a little pressure on there so that you're getting out any debris and also clearing out the bacteria to some degree. If you don't have tap water and you have some drinking water and you have enough of it, then you can use that. If you don't have that, then you're going to have to make do. This water has food coloring in it just to show it better on the video, but you could again use anything that'll hold water. And then if you have one of your safety pins available, you can just put a hole in it like this and squirt it into the wound. Now if you squirt probably about a couple of ounces per inch of wound. Of course, if it's a big wound, you could just pour the water. You could just pour the water into it.